So what distinguishes Mallinckrodt from other institutions? A number of things. First of all, we're the largest training program in the United States, and that means that we have an amazing depth of faculty and a wide diversity of residents, so the opportunities for learning in this environment are really exceptional.
We have a lot of clinical material. We have experts in lots of fields who love to teach and love being here. This is a nurturing environment.
The culture of the reading room at Mallinckrodt is a lot of one-on-one interaction between residents and faculty. We let the residents work their way through the cases, and then the cases are reviewed along with the faculty directly so that consensus interpretation is reached. The residents generate their reports, the faculty edit their reports so that they get feedback about how they can make them better. But it's this one-on-one interaction in solving clinical problems that I think is the most important part of the reading room environment.
The thing that's so awesome about this place is it might be the big names that draw you here, and those are the big names you're going to be reading by in the reading room. Those are the same people who you can be talking to and ask, well, tell me about this disease. That we place a lot of value in that one-on-one teaching. And I think it's important, and it's something that we don't necessarily think about when you think of a large residency program, but because we divide the residents into these smaller rotations, this time and opportunity for individual teaching exists on every service for every resident.
This is a very hands-on residency. They have opportunities like no other place in the United States or the world.
Residents get to do a lot of procedures, and that's very, very unique in the sense of across the country, and that they get to do a lot of procedures that otherwise they would not be able to do and be involved with.
They're really not going to learn how to do procedures by watching somebody else. They really need to get their hands on the equipment and have the hands-on learning with the patient. So getting them involved, teaching them how to do procedures under supervision, and then gradually as they progress, letting them take more and more responsibility until eventually they're doing most of the procedures by themselves.
The on-call experience, it's one that you're on with colleagues, so you're often on with 3 other residents or 2 other residents at certain times of day, so you always have a peer that you could run something by.
You always have another set of eyes, in fact now multiple sets of eyes to take a look at cases.
Mallinckrodt Institute and Washington University are some of the most published departments and institutions we have in the country. And so there are research venues throughout the university. And I think because of the collegial relationships we have with many of other departments, that can be expanded.
It's really easy to do research at an academic powerhouse like the Mallinckrodt Institute of Radiology. The key to a successful research to me is to find the right mentorships and research projects.
I like residents who are interested in things. If they're interested, it spurs my interest and it goes back and forth. I will do anything I can to help that resident succeed, both on the service and in their future career, particularly with research and clinical care of patients.
The people here are phenomenal, and I think that that is what makes this program a standout.
We all love teaching. We think that the teaching is an important component of what we do. And we want to make sure that our residents are well-trained.
It's a great opportunity for me to impart what I have learned, to train them so that they can train the future leaders of radiology and medicine.
The thing that I'm most proud of is that I've been able to turn out individuals who are great clinical radiologists, individuals who are academic leaders in nuclear medicine and radiology, and I think that's much more important than really anything else I've done.
I think it can, number one, allow them to see what we do day in and day out so that they can choose their passion. I know what mine is. It took me a while to get there. I know what it is. It's important not just to have a job, but to have a career and a passion and to follow that.
I think any resident should ask the fundamental question of what do I want to be, what do I want to do with my life, how can I be the best radiologist that I can be, but also how can I be the best physician that I can be. With that in mind, I think Mallinckrodt is the best program you could think of.